Opioids in the Capital Region, what every family needs to know. Sponsored by Walmart and the National Summit on Opioid Awareness Campaign.
I think she just got mixed up with the wrong crew. And someone said, hey, try this. That's where it started. It just had a hold. It was just too late.
The reality is that moms and dads across this country are burying their children because they've been poisoned.
Our overdoses are like, through the roof.
I mean, 30 seconds from the jail, we can buy drugs.
There you go.
This is only probable cause for a search warrant. So as long as I can prove that I got a substance.
There are no drugs on the street available to buy that are not filled with fentanyl.
It's very easy to make. It hits quickly, it works quickly, and that's what makes it so deadly.
This is a disease of the brain, and it's not a lack of willpower.
Welcome to Opioids in the Capital Region. I'm Trishna Begum. Over the last month, we have been working to cover this crisis from every angle and find out what every family needs to know. For the next half hour, you'll hear from doctors and community outreach leaders to those on the front lines coming face to face with fentanyl, a leading cause of death for the majority of overdoses across the country, including here in New York. We will join local investigators executing a drug sting in real time. It's families like the Piscatellas who are at the heart of this issue. They know firsthand what it's like watching a loved one struggle with addiction. They lost their daughter in 2019. Mom and Dad, Lynn and Tony, now use her memory to serve as a warning about the tragic consequences of taking a chance.
She was a bubble. Jen was the happy. Jen made me laugh. She made me laugh. I miss that the most, right?
Lynn Piscatella wanted to shine a spotlight on a dark addiction after her oldest daughter, Jennifer, died.
What Lynn did, I can applaud today, and I have all these 5.5 years since Jen's passed.
Our beautiful daughter, Jennifer Nicole Piscatella, 28, of Rotterdam, New York, was quietly taken from this world after an accidental overdose. She was a gift from God, and we truly believe that. Jen has brought much light into our lives, and for that we are thankful. She is now our angel in heaven, my baby girl.
Born September 27, 1990, Jennifer left behind her younger sisters and 2 loving parents, Lynn and Tony.
She made us parents for the first time. How awesome is that? And there she is with her sister Taylor.
Raised in Rotterdam, the Piscatellas described Jennifer as a star student and an exceptional athlete.
We have a basketball court in the backyard.
Yeah, we put a full court back there.
We have a swing set in the backyard down by the basketball court, and I still sit there. I still sit there looking up at the fence and just waiting for Jennifer to come down and just say, "Dad, let's shoot some baskets."
Jen graduated from Mahonison High School in 2008 before heading off to college. Along the way, she carried the pain of her injuries, something her parents now recognize as the first sign of trouble ahead.
Well, I know it started in college, trying to keep up with the schedule of playing basketball, yet keeping up with her academics. Again, her shoulder pain, she had ankle injuries. Hydrocodone, that's where it started, and then it ventured out to heroin. I think she just got mixed up with the wrong crew. Someone said, hey, try this.
I just wish that she would have reached to us more for help. And that's what I mean. As a dad, I wish I could have done more.
You know, she had gone to rehab quite a few times. She'd go, and it just had a hold. It was just too late.
On April 29th, Jennifer was found dead from an accidental overdose. Toxicology reports showed fentanyl was present.
We know that she didn't take that drug to die.
Her dealer was prosecuted in federal court and served time, but none of it brings Jennifer back.
This is what we have of Jen now. This is Jen. This is Jen right now. She's our joy.
Determined to keep their daughter's memory alive, her heartbreaking obituary has made an impact on the Capital Region and beyond.
What that has done, we've had people reach out to us. 2.5 million people read her obituary.
Please, if you are reading this obituary and you're thinking, I've got a handle on this, or I can control this, you can't. Jen thought she could. Now she's an angel in heaven. As much as we tried to help, it has to be up to you. Ask for help, and we, your loved ones, will come running.
Jennifer's struggle serves as a somber call to action.
It made me feel good that we saved someone else. We may not have been able to save Jennifer, but we saved someone else's child.
Jen has brought much light into our lives, and for that we are thankful. I wanted people to know why I was her. I didn't want them to feel sorry for me. I just wanted to, I was mad and sad, but this is why.
Through her grief, Lynn is helping turn the stigma of addiction into a conversation every family should have.
Because I think if more people were not embarrassed that their child and, oh my God, I was a bad parent. It's not bad parenting. It's just, it happens. It's an accident. And there's so many families like us. It's not just us.
In its latest report, numbers from the Centers for Disease Control and Prevention show an estimated 6,200 New Yorkers experienced fatal overdoses between May of 2023 and May of 2024. Regionally, provisional data shows that there were more than 500 overdose deaths across 8 local counties in 2023, with the majority of them being in Albany, Rensselaer, and Schenectady.
And there are a lot of reasons why people become addicted. One reason is some people have a genetic predisposition.
Dr. Charles Gordon, a pain management doctor in Clifton Park, has watched the opioid crisis unfold for the last 25 years.
And then we were told for chronic pain that if you had chronic pain, no problem, you could give these long-acting opioids and you could put patches on people, you could give them medications that would last for 24 hours, and they were very safe. It worked great on cancer patients. It can be very helpful in that setting, but other patients, they just required more and more and more, and you get to huge doses, and finally many of us started to say, there's something wrong with this. This isn't working right.
Synthetic opioids were designed to help patients, especially in the hospital setting, who were in extreme debilitating pain.
But opiates are great painkillers. That's what makes it so challenging.
Dr. Gordon walks us through what happens to the body when the drug is consumed.
The number of receptors keep growing to keep you at your normal state. And then if you keep chasing the tail of this, you get to a very high level, which is your normal. And if you don't have some opiate other than your own in your body, you feel awful. You just crave it. Your heart rate goes up, your breathing increases, you become moody, you lose that euphoria. Think of the opposite. You can get angry, you can get hostile, and you will have this craving, craving for the substance, because that'll bring you back to a position or a feeling or just a body state that's more normal for you.
Though prescription opioids are not the primary source of overdoses, they can be a contributing factor, according to the CDC. Dr. Gordon says overprescription has been an issue. In Albany County last year, the average opioid dispensing rate was 46 prescriptions for every 100 people, which is on track with the national average.
Nobody's safe. Everybody's at risk. This is the midbrain here. This has your respiratory centers, and that's the part that gets affected that actually kills people because it makes the breathing stop. Basically, when you talk about medications and drugs like fentanyl, it hits quickly, it works quickly, and that's what makes it so deadly.
It's the leading cause of death between the ages of 18 and 45. It's more than car accidents, it's more than suicides, and more than gun violence. So this is the threat that we're facing across the United States.
The DEA calls illegal opioids the most dangerous threat facing drug law enforcement across the country. Special agent in charge, Frank Tarantino, oversees the New York division.
The New York division seized 4.4 million fentanyl pills and 1,200 pounds of fentanyl powder, enough to kill approximately 39 million Americans, twice the population of the state of New York. That's the impact that the law enforcement, men and women in DEA and all of our state, local, and federal counterparts are involved in each and every day.
As he explains it, all it takes is 2 milligrams to kill.
Take your salt shaker, pour out 10 grains of salt on your table, and look at that. That's a lethal dose. That's what's killing Americans.
That's how much it takes to kill.
That's it, just 10 grains of salt.
In 2022, more than 110,000 Americans died of an overdose, 69% of which were a direct result of fentanyl.
The reality is that moms and dads across this country are burying their children far too soon. And they're burying their children because they've been poisoned. It's impacting parents, teachers, caregivers, people in positions of authority. It's impacting everybody. We all know somebody that has become a victim of this crisis. The synthetic opioids, specifically fentanyl, are what is driving addiction.
It just seems like people are actively looking for heroin with fentanyl because they will report to us that it gives them a better high.
Local deputies like Daniel Morrissey and Jamie Panici with the Rensselaer County Sheriff's Office are driving the effort to get those drugs off our local streets.
Right, you read me?
In November, we were given exclusive access to ride along with investigators from the Rensselaer County Sheriff's Office to watch a drug sting in real time.
See eyes out.
I'm going to grab the informant here in a minute.
Your confidential informant is searched to make sure there is nothing on him to interfere with the investigation.
You got the money? I'll give you that real quick.
And then given a recording device. To protect the CI's identity, we will not disclose any street names or show the specific neighborhood.
Walk up and walk down, right?
Absolutely.
See you in a couple minutes.
Go back the same way.
Yep.
Ready?
Yep.
So the CI is now out of one of our vehicles and he's walking up to the location now.
We're trying to do a controlled purchase of heroin or crack or whatever he can come up with.
While their informant is walking down the street, every move is documented by Sergeant Panici, who's in charge of the Drug and Criminal Unit. Critical steps needed before a search warrant can be executed.
How much you want?
4. Okay, I need 4.
And? 4? That it? You want 4 and then a dough?
No.
Okay.
I want 4 bags.
Money goes here now. Money goes here now. Go to my room and I'll be right with you. I appreciate you, bro.
10 minutes and $100 later, the informant is back in the car.
So we got a little bit of crack and what looks to be some heroin. And we'll take that for testing.
How easy is it to find?
Anywhere and everywhere. Anywhere and everywhere. There's probably 2 houses on each block as you're driving through.
The danger in handling the substances is clearly evident as it's bagged up and driven back to the station to be tested under a special hood with a filtration system.
Because with fentanyl, if you inhale it, you can be exposed to it. So we'll put it in there and then I'll break it up. We'll put it into the test kits. Break open these ampoules that are in there as an acid. It reacts with whatever the substance is and it'll give you a color code, either heroin or fentanyl. Very small amount. Okay, wow, it's the pink stuff. There you go. Positive for fentanyl.
Proof that illegal drugs were being sold out of the unit they were surveilling. The result? Probable cause for a search warrant.
We'll take it, we'll label it, we'll put it into evidence. Trying to go after drugs on a local level, it's obviously challenging.
It takes time and a lot of resources.
And we're not a huge organization, but we consider ourselves like a street level unit that's going to go out and try to get into the crack houses, get into the heroin houses, and just make a statement that we're here and we're looking for you.
Making the task of cracking down on drugs more challenging is what happens after they're arrested.
People that are already out on bail are doing it again and then being released again. If you want to get a dent into the drugs and the overdoses, you've got to bring that bail where the qualifying offense for narcotics has got to come down under 4 ounces again. It has to, because we're just picking these guys off left and right, and they're getting back out, and they continue to go ahead and sell again. I've got several cases that I've re-indicted cases after a sale of a case that he's already pending. Like he's back out doing it again, or she's back out doing it again. And it's like, what do you got to do? How many times do you have to do it?
As they try to get more drugs off the streets, they're also trying to steer people who need the help in the right direction.
The people that are involved in this, we hand them the olive branch of getting help and rehabilitation. That's a big part of what we do. Because my thought process is go after the supply and the demand, and if you can get both the dealer and the person using and separate the two, this one goes to prison, this one goes to rehab. I mean, that's the best case scenario.
As of right now, the drug sting is still pending investigation. According to the Rensselaer County Sheriff's Office, there have already been 43 deaths this year related to overdoses. Rensselaer County was just designated a high-density drug trafficking area earlier this year, joining Albany and Schenectady. This makes all 3 of those counties now eligible to receive more resources and funding from the federal government in their fight against the opioid crisis. In the first 6 months of this year, more than 1,300 people were admitted to addiction programs in Albany County.
We can get people into treatment basically under any circumstances in about 6 hours.
Wow.
Yeah.
Kelly Rowe heads one of the 3 recovery and support centers within Albany County at Second Chance Opportunities.
We bridge the gap between treatment and recovery. So most of the people that come to us are coming out of treatment. After about 4 or 5 months through the treatment process, they come to us and they're looking for housing. We also get people into treatment. We also transport people to treatment.
So far this year, she and her team have helped around 300 people get into recovery programs despite any barriers that may arise.
If you don't have insurance, we can get you insurance. If you have insurance that won't let you go to treatment, there's a team of lawyers that works behind the scenes.
You got to strike when the iron's hot. When the individual says they're ready and is looking for the help, it's very crucial that we have that help available at that time. We have a lot of individuals that come to us that, if we wait a day or two, they may overdose and die.
Families are scared to death. Having a child or someone you love that has an active substance use disorder is terrifying.
Has it gotten more dangerous, worse, more intense?
I think the danger of active use has definitely gotten worse. Yes, absolutely. Because even 2 years ago, you could still potentially buy drugs on the street that didn't have fentanyl in them. Now that is not the case. We give out testing strips, but as an active addict, I was never going to test my drugs before I use them. I don't think it's a realistic solution, although every solution matters.
Second Chance Opportunities reaches across 8 counties in the region. The grants they've received have helped them establish a transportation program that remains crucial in the recovery process.
We provide transportation not only to treatment, but we help individuals overcome barrier of getting to treatment court, getting to their probation officer, getting to family visits. So we provide transportation for anything that's going to help them overcome a barrier.
Probably one of the biggest barriers, believe it or not, could be their location and being able to get here to treatment with consistency. If they live right here in Albany, public transportation is wonderful, but if they live in a rural community or something like that, it might be very difficult for them to actually make it to treatment.
Experts say there are multiple pathways to recovery, including the use of other medications to help manage a person's addiction. Tell me a little bit about what happens at this window.
Sure. So when a patient comes in to get medicated, they're going to step up to the window. This is where we dispense our methadone, which is an MOUD, a medication for opiate use disorder.
Clint Garrigan, who is the Director of Outreach Substance Abuse Services at Whitney Young Health Center, gives us a look at another side of treatment you don't often get to see.
I think I would ask families to be patient. There's a lot of stigma attached to this. There's a lot of mystery and there's a lot of unknown. There's a lot of perception that people have. It can be really scary for an individual to make those changes and to live a completely different life. And that's part of what we do in treatment, is help that person get to a place where they're able to stop using or use differently or use less because we are harm reduction.
The need has become so big that part of the Whitney Young building is under construction as an addition is built on.
We always have phone calls. We always have people seeking treatment, looking to come into treatment, looking to come back into treatment.
Part of the problem is what we don't talk about what people look like when they're in recovery.
Some of those in recovery work in the Second Chance Opportunities office.
Thank you for calling Second Chance. This is Karamia. There's a lot of shame and guilt that comes with it. It's like, how did I get here? How did I get there? You know, I was not raised that way. I had a pretty typical upbringing, loving parents, and I don't know how I ended up getting there, but I have made my way back, and I try to focus on that.
At the peak of her substance abuse, Canali was using opioid prescription pills and other hard drugs. She was arrested twice in 2016, the first in connection with a boating accident that killed a young girl on Lake George, and the second for driving while under the influence of drugs.
I remember how I felt when that happened, and just being in a completely different place in my life now. I just hope that it reaches someone that feels the way that I felt back then.
She went to treatment for the first time in 2015, but it wasn't the last time.
It's not like I woke up and decided to, do fentanyl.
Were you ever terrified, scared?
Of dying? Yeah. That's why it's so hard for people to understand that, I was afraid to die, but I could not stop. Okay.
Canali has been sober since July of last year and is taking her recovery day by day, focusing on her second chance.
This is a disease of the brain, and it's not a lack of willpower, and it requires support and love and, healing to get to a place to, abstain. I'm not there anymore, and I'm so grateful that I'm not, and I just am able to live this incredible life because of recovery and because going to treatment and getting involved with Second Chance. Yeah, I'm very fortunate.
There are resources to help you and your family. For parents trying to figure out if their child is using their phone to communicate with dealers, the DEA offers a unique resource to help you decode those messages and learn what those emojis really mean. New York State's overdose dashboard shows from 2023 to this year, there's been a 22% decrease in deaths from fentanyl, heroin, and other synthetic opioids.
This is not a war on drugs, right? This is a fight every day to save more lives. By holding these drug traffickers, these street-level dealers, these wholesale distributors, these cartel members accountable, and also prosecuting those people for those death-resulting cases for killing the young people, that's saving lives, and that's having an impact. So this is not about waging war, this is about saving lives.
They are not necessarily bad people because they want this medication. They have a firm belief that this is what's helping them.
Kids have their own iPhones. Dealers are just a phone call away.
It's more dangerous too, though, because you don't know who you're talking to.
I think we just need to, as parents, be more aware and be there for our children.
The level of shame that parents feel and loved ones feel, husbands, wife, the whole run the gamut, literally prevents people from reaching out to get help.
So when we find somebody that's struggling, I feel like we go the extra mile. The harsh reality is if you continue down this path, you are no longer going to be here.
If you or a loved one is struggling and don't know where to start, the resounding message from everyone we spoke to is to simply take a step forward, make a call, reach out to each other, and don't be afraid to say that you need help. The story doesn't end here. It is a topic that we will continue to cover on air and online. And as always, you can find all of these resources and this full program at news10.com. Thank you for joining us this evening. I'm Trishna Begum. Have a good night.
Opioids in the Capital Region, what every family needs to know. Sponsored by Walmart and the National Summit on Opioid Awareness Campaign.